Good afternoon, everyone who is viewing us. So we are in this big online event setting. So academic pediatric management in the PMG framework. We carry on with this event, and our next speaker is also a speaker from Lithuania, Asta Labadia. So, and Asta Radzevičienė, who is the chairwoman of the Association of Preterm-Born Babies in Lithuania, Growing Lithuania Project National Initiative leads. So we are very glad to see her, and we are very thankful, utmost thankful to Lithuania for their unfailing support that they provide here in our Ukraine in this grim time during the wartime. So can you please make a start of the presentation?
Hello, do you hear me? Do you hear me good?
Yes, we can hear you very well. We can see you and we can see the presentation, so you can proceed.
Perfect.
Thank you.
So hello, everyone, and thank you very much for having me here today. Especially, I thank you to my friend and colleague, Alexandra Valasna from Early Birds Organization, and for a long time cooperation. I'm very excited to be and presenting here today, sharing Lithuanian Premature Baby Association, NEISNESIOTUKAS experience, of course, not easy experience in follow-up and parenting support. So how it started, why I am here today. I am a mother of premature baby girl who was born on 2008 on 26 weeks, and she weighed 960 grams. So it was a long time ago. This year she's turning 16, and medical support and psychological support, everything was different. So I spent 107 days in a NICU, and it was a real roller coaster for me. And after 2 years, I decided together with the other premature baby mothers to launch Premature Baby Association in Lithuania, because before that there were no community, no information for parents, no stories finding in internet, especially when social media was only in the beginning. So Lithuanian Premature Baby Association, its short introduction, was founded in 2012. And now we are very proud to have almost more than 100,000 members of the community, including families, including doctors, including sponsors, also including patrons and politicians and ambassadors. So today I'm going to share with you how Premature Baby Association manages to follow up parents after discharge from the NICU and still in the hospital, and how was our road talking about standards of care and cooperating with specialists in implementing standards of care in Lithuania. So as we know, family is the most important thing, and the baby is not hospital's baby. A baby doesn't belong to the hospital. Baby belongs to the family. So we really need to take care about the family to bring all needed surrounding care for the family. And what is important is, of course, parent-to-parent support. Parent-to-parent support, that's why we really need community to feel not alone, to feel that we are together and we have support, each parent-to-parent support. So, of course, it's very important information, where you get information that is really competitive, that is really clear information, and it's really healing information for the family. Of course, professionals, without them, we wouldn't be born our babies wouldn't be born and cared for. So professionals are very important. Events, of course, events is like community together during events like World Prematurity Day, like community meetings, like discussions, and of course, supporting each other. And advocacy. Advocacy, that means that we as organization, we are a voice of the parents, and we are a voice of the smallest premature babies. So parent-to-parent group, support groups have started, well, long time ago. And what it worked for us was amazing meetings organized in a NICU. So we are really thankful for doctors who allowed us to go and meet families in the hospitals and talk to them and support them during this road, because the road is really long. As for me, it took more than 3 months. So what do? We organize relax therapies in the NICU. So every month we have meetings with this is premature mom. She has a knowledge and experience, and she's professional in relaxing therapy. She is organizing meetings, which really helps in emotional support, and where parents could get, well, like practical advice and professional help. And of course, we provide with a safe space. This is most important for families, to have a safe place to open for speaking what they really need, what problems they challenge. So this is what we provide for them. And of course, a sense of belonging that you're not alone, of belonging that someone cares about you, and it cares about you not only in the hospital, but after discharge and for a longer road after child becomes teenager and adult. And of course, they receive encouragement and inspiration to not to lose hope. And if a baby is really very small and has very bad situation, so of course, in our community, we really have different situations. So that's why we are trying to match some parents, to match families. And we also have a closed group in a social media where parents can ask questions and share their experiences, because there is a lot of unknown things, and it's very scary. And of course, we encourage about healthy habits, so to take care about the family during being in a NICU, because it's very important when parents is in a NICU, especially these days. I think in your country, where only moms can be alone with no mans, no husbands, no dads. So it's very challenging. So it's very important to encourage mom to mom and to support not losing hope, because she is the only world for her baby at that moment in a NICU. So what we are trying to do during this more than 10 years, also to meet parents in a NICU and arrange some entertainment, like to say, like yoga and some handicraft things. And also we try to support them during main celebrations and visit by our volunteers who are also parent moms, and they have peer-to-peer support groups when it's possible. After discharge, it's very important to follow up the family, and we are very happy that we have follow-up to 2 years in Lithuania, which is very, very important for our babies, especially these first 1,000 days is very, very important. Because for example, in my case, what I felt when I came back home, that of course, I'm alone, but I have a support. I have where to call and ask for specialists. So we had visits every month, and we are checking eyes, ears, the development of the baby, and if it's like on time or it has some problems, so we need to check. Because parents, they really don't know, and they don't know how to follow up the health of the baby, especially when it's, standing later, or you are like trying to compare your baby with a neighbor's baby who was born on time. So we really need to check this medical care, because we really don't know about the eyes. For example, if my baby will see, after being 1 year of premature baby's mom, we found out that our baby, she's seeing very, very bad. I mean, her eyes are very bad condition. Of course, she had retinopathy, she had operation, but we really don't know, because she was walking and she was like seeing or not seeing, we didn't know. So after 1 year, she had to wear glasses, and it's very important to follow this, especially educating parents to follow. And what we did, we did gathering together preemie moms in one place and exchanging the information, exchanging the support. And it's very, very important. It's a small thing. This is, in these conditions nowadays, what we can do. The most important is to feel not alone and to attach to the same mom as I am, just to be together, just to talk together, just to empower each other. Also, during the pandemic times, challenging times, we launched the helpline where parents could ask for help, frequently ask questions. But what happened, that of course parents are calling to this line, but also grandparents are calling to this line, and friends are calling to this line, because they really don't know what to do. They really want to help for parent to support during this challenging time and shocking time and this trauma time, but they don't really know what to do in the first beginning. That's why they are asking us for advice, how they should do that step by step, not to be more connected with the parent, not disconnected. Because at the first beginning, when it's very traumatized experience, mother really wants to be like a little bit isolated from the family, because she thinks that family don't understand her experience. And of course was also a time where professionals or nurses were calling us and also asking for help and searching for help. During pandemic times, this were very challenging, and everyone was looking for some help. So helpline really works, especially now when we, of course, maybe in your situation where it's no such connection and physical connection. So what we did that we are very happy about, we did emergency kit. That means in 2016, we launched, we gathered together moms, premature baby moms, and we decided what should be inside the emergency kit. The emergency kit is given to every family for free, and it includes information like books, like preemie clothes, like notebooks, like water, like teeth paste, like, different things, hygiene things. which are very important in the first days of the family. Because, for example, in my case, I delivered my baby 3 months ago. I was just sitting in the office and I just ran for just usual check with my doctor to check the situation of the baby. It was usual check. And she was telling that the baby, she's lack of oxygen, so I need to go to the hospital. And Margarita was born in 2 hours, so I had nothing to prepare. Of course, I had no clothes, nothing at all, no hygiene things, nothing. And of course, no information. So what is most important thing, that this information, like, for example, book, help a lot also for medical staff, because parents had a time to read information. And after reading information, they had questions to ask. Because opposite, it was like first like coming questions, or just we're thinking that, well, we're afraid to ask questions because we really don't know what to ask. So the books are really very important for parents. Of course, the books came by time, and we are very happy that we have the book, which are free of charge, included into the emergency of kit. And also we have a book of stories, different stories of different premature baby situations. And we also provide online webinars and seminars, of course, and nowadays it's very important and very easy like to do online. And of course, we have online education platform, Growing Lithuania. I will mention it later before. Also, after discharge, when the baby is follow up during these first 1,000 days, which are very important, and also up to school, where we should follow the development of the baby. And we have a community where parents asking for help, and because they really don't have like possibilities, financial possibilities to buy some medical things that they really need for their babies. And you can also see here a few babies where we provided them with oxygen, with different stoma things, with prevention things at home. And we try to follow up them also with a help of sponsorship. And of course, family support at home is very important, communication, because not of them are so brave like to ask for help. And this is very important, to create this safe place as community can do for their families. Only community can create this safe place, so it's most important. And now we're going to speak about standards of care implementation, which was very, very challenging for us as parent organizations in Europe, because I also represent the EFCNI, European organization. I'm in the board of Parent Advisory Board. And as we know, in 2018, the standards of care was launched in the parliament. And as a parent organizations and incorporating with specialists all around Europe, we had a challenge to speak about the standards of care in local communities. And what we started, we first of all started to communicate with professionals with Neonatology Association, and they allowed us to present standards of care in 2018 in an Neonatology Association in the conference. And of course, at that moment was challenging because it's really a big document, and it's never-ending, seems never-ending document and implementation. But what I think is most important, to be very, very specific and very consistent and patient, implementing the standards of care, implementing the guidelines, the methodology. and so on. So what we were trying to do to bring also parent groups and professional groups in a global summit for preemies in Vilnius before pandemic in 2019. And this Congress was based on the standards of care and call to action plan. And what I'm happy about that, as I say, it's most important to share the good practice. Of course, we are Europe and we have different situations, we have different moments. I mean, but it's very most important just to take a good practice and step by step, it's really important to implement into local community because we don't need to invent something new. It's done already, a lot of things done already. And in the Congress of Care in Vilnius, it was presented different experiences, different challenges in different NICUs and exchanging know-how. So it was really very nice event. And I think it's a key event where you can meet like conference like this and exchange a good practice and empower your colleagues, empower your community to share and implement step-by-step information in your country. So the last event that was based on standards of care, of course, we are coming with a few standards. That means we are not picking all the standards. So we are prioritizing the standards of care, which are important for us as a parents, for example, follow-up and education for parents and medical staff and psychological help. Also, and integration into society as integration into schools, into kindergarten, which is very, very important for us. And also, what we are happy about that the patron of our organization and events is the First Lady of the Republic of Lithuania, which is very, very important for us. Now, I will share education. It's one of the standards. I don't know which lines, it's yellow lines here. I don't know where I'm coming from. So education, what we as a parent organization are trying to do, because we are parents and we really want to help professionals to take care, the best care, to give best care for our preemies. And as mentioned before, that baby is not hospitals. It doesn't belong to hospital. It belongs to the family. And we tried to do during last years to bring educational programs, training programs to Lithuania, thanks to the sponsors and the projects from the health ministry. The projects were supported from the health ministry. And we brought the fine program from UK. It was the Family and Infant Neurodevelopmental Education Program, which was very, very successful. And it was about how to include professionals into the care of the family, not only the baby, but how to include the family from the first minutes of their family life into the care of premature babies. Also now we have very, 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 very nice training. It's mind-changing training, but it's very, very important. It's from Finland, from Turku University, Turku Hospital University, and it's called Close Collaboration with Parents. Here you see some moments from training, and now it's going one of the NICUs of Lithuania. It started in December, and now it's going for the half of a year. So it includes two health professionals, 2 doctors, and 2 nurses. Only 4 people are prepared as mentors for the whole NICU. And what is important that it's so close to the family that it's about how to communicate with the family, how to involve the family and empower, just to take a little step back and to bring mother into the care, that she would know her baby much more better, that she could know when her baby has pain, what's her baby character. Because now what we really challenge that what we do, that as we wait for doctors, right? And doctors are saying how my baby feels and when he has pain and what to do. But really, mother, she has a real huge power to be involved into the care of the baby and know her baby much more better. As nowadays we have challenge with social media, of course, and more the parents are scrolling, right? So these trainings are very important also to involve parents and to train parents too, to be involved into the care of the baby. As I mentioned before, exchanging practices in the Global Summit of Preemies. So it's very important to exchange, to have more these kind of events you have now. And of course, we had national conference, which were also very nice exchanging experience and bringing challenges of the preemies and sick babies in health, social, and education, because we really know that it's not only the beginning when you are starting with the baby in a NICU, it's only the start, because my baby will be at kindergarten, my baby will become teenager, my baby will become adult. I mean, it's very challenging, different periods. And now what we have, very nice thing that also our professor Runas Liupšys, I think, is happy about, that in his NICU we brought very innovative educational tool for training. It's Premature Baby Simulator Pro. It's a very expensive simulator, like computer, that you can train your staff and students, like how to resuscitate and different things. So it's very, very live, and it's connected with the computer. So usually you can't train on the very, very small preemies. So this tool helps doctors to be trained and to take better care for our babies. Also, we provide webinars or seminars, as I mentioned before, which are very, very important for education, and bring different partners like developmental care center, like as I mentioned before, fine training, updates, and it's about not only about the NICU challenges, but also the baby challenges in kindergarten, in school, how to recognize these diagnoses, how to recognize and how to act specialist with this kind of babies. And we launched before pandemic, we launched educational platform, Growing Lithuania. And the goal is to connect whole information in one place, because we really know that Google doesn't heal people, right? And it's very, very confusing. Also, the Facebook, we found a lot of things there, but most important to bring up very research-based information under one umbrella and involve different specialists, best specialists in the country, to speak about the key topics, how to, starting this ABC, what to do if I got the preemie, what to do if I lost my baby, what to do when I'm in kindergarten and I don't know, teachers are like, we have some conflict with teachers. They don't know how to act and deal with my baby. So during the follow-up, and it's like 3 legs. It's about education, it's about health and social things. This platform covers. And here you see the mapping. So what we did, during pandemic, we did a mapping for one of the biggest hospitals in Lithuania, because in this hospital, families are coming from different cities, and it's very confusing how to find, the right department. And we bring this online mapping that the parent could find it easier starting from the parking and entering the area of the hospitals. And this is also very important because the NICU design is a small thing, but it's so important. This is, you see, was our idea brought from Estonian Children's Hospital that we visited 5 years ago. It changed a lot. So what we did, we painted 3 NICUs in Lithuania, the walls of the NICUs, and it changed a lot the psychological design, the surrounding of the staff, not only for families who are living there, like seems like for ages there, but also for doctors and nurses, that they could have this cozy, nice surrounding during these hard working days. And it really helps a lot. It took us 4 months to be accepted by the Ministry of Health, because the walls belong to the Ministry of Health and it's governmental, but we are so thankful for this opportunity. And when we painted one hospital, then another hospital wanted the same to be in their NICU. So it's a small thing, it's a low-cost thing, but please think about this nice designs. I think you could find volunteers to paint the walls, but they really change your psychological surrounding and makes the family, live there much more like at home, feel like at home. So this is one of also our family rooms launched in 2 hospitals, where family can just sit and drink tea or just listen, sit with a doctor and speak about the serious diagnosis and not maybe good information about the baby. So we wanted to create very nice and cozy surrounding and safe surrounding for the families. This is a short our work in presenting the standards of care in round tables, because it's very important to speak and gather together all the professionals under one table. And this is, you see different specialists. It was different specialists in 5 cities, 5 main cities, and connecting with local family doctors, neonatologists, therapists, developmental specialists, psychological, social workers, residents, teachers, and of course, parents. And we also involved local municipalities, the representatives of the health departments and social departments. So what benefits these kind of meetings? The most important is to sit on one table. This is a huge step, and its step is today. I'm so happy that you had this events like today, gathering on one table, because then we need very, very consistent and patient work. And of course, acknowledging that there is a lack of information and communication. And of course, now we are very happy that we have investments from Swiss Fund in development care of the regions. So these regions, now we have more support in working with the families, and not only in the hospital, but also after discharge in different hospitals, in therapies, social centers, and schools. And of course, challenge will always be challenge with structure of the plan, of responsibilities, and of teamwork. But it's also very small, but very important thing to be supported by the communities, by the municipalities in different cities. And last year, World Prematurely Day was celebrated in 27 municipalities. 27 municipalities gathered for the voice of preemies, that we are very, very thankful. And really every municipality had their voice and table or coffee or round table to speak about premature babies and to bring this topic out. And as I mentioned before, it's very important that to have patrons, to have sponsors, to have ambassadors. So we are very thankful that our First Lady of Lithuania is our patron and helps us in raising the voice of premature babies. And for the last, I would like to wish that only working together, we can help each other work for the benefit of premature babies. So I thank you very much for your attention.